We'd like to begin educating clients about core beliefs, modifying them, and developing and strengthening new core beliefs at the very first session. But if you do that with most personality disorder clients, you'll run into trouble. I'll discuss with the Beck Institute clinicians when we should provide education about core beliefs to clients and what we might say. We have to educate our clients about core beliefs. What are some of the prerequisites that guide you in deciding when to start this process of education?
Well, first you need to have a credibility with your client, and the client needs to trust you. The client also needs to trust that you know them well enough, that you have evidence to support a new core belief and evidence to weaken the old core belief. So for example, if the new core belief is about being competent, as the clinician, you need to have evidence that they're in fact competent, or at least competent in some areas.
Also helps to know that they're functioning better, that they're actually, in essence, I would say off the ledge. There was a client who, pretty much in the narcissistic spectrum, who had read a lot about CBT and wanted to delve deep into childhood issues, but he really wasn't ready for it. He really wasn't ready for it. I likened it to being somebody who was on the ledge. I had to get him off the ledge into the room before he could do that work.
What was his ledge?
His ledge was basically suicidality. His ledge was really severe depression. His ledge was the fact that he was not getting outside the room, outside the bed much of the day. He was in total and thorough hibernation mode. I would almost liken it in some ways, I mean, it might be a bit extreme, it's almost like having a cancer patient with a gunshot wound. I think it was
better to tend to the gunshot wound first.
Yes.
Yeah,
you tend to that wound first, you tend to that priority first, and then you can treat the cancer.
So get him out of the room, into real life again,
Yeah.
and functioning at least at a higher level
Yeah.
than he was.
Absolutely, before we can work on the issues that he would consider deeper at root.
And with what Norman's talking about, you want clients to have a decent ability to regulate emotions or tolerate emotions, because when you go over core beliefs, there's typically going to be some pretty intense emotion that's going to get stirred up, so clients need to be able to regulate that and tolerate that. And with that, beforehand, you want to make sure that they also buy into CBT in general, and that they've had success responding to automatic thoughts and intermediate beliefs, so that they trust that in responding to core beliefs and working on them, they're also going to have success.
So they already know, just because I think something doesn't necessarily mean that it's true.
Exactly.
And if I evaluate it, find out that it's not completely accurate, and change my thinking, I feel better.
Yep.
And so that's established before you do a whole lot of work on educating about core beliefs.
Yeah, definitely.
So to summarize an important point, we tend to do direct core belief work on both old and new core beliefs as soon as we can. But often it's toward the middle of treatment, especially when clients present with an acute disorder. On the other hand, one study by Keefe and colleagues focused on clients who were depressed and had a personality disorder. Their research showed that outcomes were better when therapists start working on core beliefs early in treatment. Of course, this one study needs to be replicated. Our clinical experience has demonstrated that many clients with personality disorders react negatively to core belief work that is introduced too early. Next, I'll ask our clinicians to talk about what they think is important for clients to understand about their core beliefs. Okay, so you and your client have identified a really important negative core belief about the self. What do you want clients to understand about this? Let's start with a few items, and then we'll add some more later.
One is that the core belief makes sense given how the client interpreted different situations, usually from their childhood. So I can think of a borderline personality disorder client who has the core belief of being unlovable, and he had really abusive parents. So it makes sense that, you know, when you're 5 and 6 years old, that you think everything kind of revolves around you. So you would imagine that mom and dad are being really abusive to me because there's got to be something about me. And with that, it's also that although they may have, the core beliefs may have been adaptive or somewhat valid early on, kind of in their current life, they're not completely adaptive, they're not completely valid. So that same person, you know, he was married to really a kind, caring wife, and that idea of being unlovable just wasn't valid anymore.
Yeah, I can also make the point that these beliefs are lenses by which you see the world. In some ways, we can guard ourselves as being almost like optometrists who are giving clients different lenses to try on for size. This client that I had who saw the world in terms of ridicule, of people mocking her. It was really something that she had experienced in childhood. And it was hard for her to see the world outside of that particular lens. And the idea of being able to view that as being a perspective, not necessarily a reality, is important for her because her natural inclination is to view things in the lens which she learned early on in childhood.
And what was the lens by which she viewed herself? What was her core belief about the self?
Saw herself as being the object of that ridicule, saw herself as being victimized by that ridicule, saw herself as being made powerless by that ridicule.
Right.
So we want our clients to understand that their coping strategies speak of the rules that they're living by, the if-then statements that they use. So I'm thinking of the client you mentioned earlier, and I also have clients with OCPD who have this belief that if I do everything perfectly, then others won't know that I'm really incompetent or defective.
Here's a reflection question. What do you want to remember about when to start educating clients about core beliefs? And what do you want them to know? And now I'd like you to do a role play or write a script in which you begin to educate clients about core beliefs.